JICA is Japanese one, GTS is a German, China, NORAD. There are many others. Practically every country has a program with another country. Most of them are linked with African countries than with Asian countries. And then, of course, you have the non-governmental. So 3 types, non-government. Here we have maybe more than 2,000 NGOs in the world, non-government organizations. The big ones that we are dealing with, I'll mention 1 or 2 of them later on. Then a word about the World Health Organization very quickly. It is mandated to lay down global health policy. Therefore, once a year, in May, 3rd week of May, the World Health Assembly meets, which is made of all the health ministers of all the states, of the countries of the world. There are 193 members now who discuss health policies, the global health policies. And the objective of WHO is the attainment of all peoples, the highest possible level of health. These are in the Constitution. These are the core functions of the WHO. I won't go into all of these, but basically saying providing leadership in global health matters, shaping the research agendas, setting norms and standards for various things in various aspects of health, and of course monitoring the health situation and addressing health trends. WHO is mandated to do all of these things. Now, I just want to show you this quickly. This was the WHO agenda. I picked up the 1961 agenda of the World Health Assembly. You'll find that most of the things, except 1 or 2, are relating to communicable diseases. Now, this is the agenda of last year. A few more, I mean, the agenda is much longer. I picked up the main technical ones. Here what you find is, over the years, while the disease-oriented agenda items remain reasonably there, more and more items are coming in which are more quote-unquote political in nature. Intellectual property rights, you know, the tobaccos, the alcohol, these are more political issues. So WHO is also moving into the social dimension of health and the political dimension of health more than, say, 50 years ago. And this is a trend of the times. These are trend of the times. These are some of the current items on the agenda. International health regulations. IPR is property patents, basically the patent laws, etc. And now some of the other powerful things are the health system strengthening programs together with some of the other agencies and the current ongoing Millennium Development Goal effort, which is supposed to be going on till 2015. And of course, the emerging major problem in most of our countries, the non-communicable disease problem. This UNICEF. UNICEF is mandated to protect rights of children, with the basic premise that every child is born with a right to education, health, a name and a nationality, protected from harm and right to be treated equally. That's the premise of the UNICEF's work. And its areas of focus are child survival, basic education, HIV/AIDS. I won't burden you. Don't worry, I'm just going through this very quickly just to give you a breadth of, just a feel of what each of these agencies is engaged in. Now, this is important because in 1954, see, the UNICEF is a very innovative organization, unlike some of the other organizations like WHO, which are more conservative. They made a film with Danny Kaye, who none of you will remember, except few, maybe Lalita and I remember Danny Kaye, who was a famous comedian of the time, which was a hit. And that kind of idea has always been continuing with UNICEF. They do all the innovative things with regard to funding, movement, health promotion. Finish? Yeah. Please tell me when it's about 2 minutes, then I'll, yeah, okay. Huh? 2 minutes, I'll finish, yeah. So I'll go through that. These are some of the things. UNICEF also won the Nobel Prize. UNFPA, mainly with the mothers and the children. The UN is now more involved in health. Particularly, UN had, for the first time, I think they had a summit of heads of state for health, which was in 2000 on HIV. That's the first summit UN had, heads of state summit. Last year, the UN also held a summit of heads of states on non-communicable diseases. Those are the only 2 summits that the UN itself has had. Bank, of course, now become one of the largest funders of global health. About 30 years ago it started. Now it is providing probably the largest amount of money to countries for health, and Sundar probably might mention a few things about Sri Lanka. These are the bilateral agencies I mentioned, and these are some of the funds and the foundations. The 2 biggest foundations, of course, right now, the Gates, the biggest foundation, the Gates Foundation, which has more money, by far more money than the WHO by many times, I think it's also as big as the World Bank in its funding program. Now, some of the outcomes very quickly. This is the first part, that what happened, health getting organized, I mentioned. This is a time that the 50s and 70s were era of consolidation, disease-focused work. Then 70s, the primary health care and health for all came in the 1970s and 80s, end of the 70s, PHC. Then later on, we have health sector reform movement in the 80s and 90s and continuing. And then from 2000 onwards, what we call the era of new universalism. That is the general sort of concept of health that a lot of countries are pursuing. Then you want me to say a few things about impact. I'll make just 2-3 slides on that. Achievements in public health because of the international agencies, not entirely. Ultimately, it's the country's responsibility. Countries have contributed the most, facilitated by the international agencies. We helped in different ways, technically, capacity building. See, worldwide, a child born in 1955 had an average life expectancy of 48 years. By 2000, the average life expectancy had increased to 66 years and projected to rise to 73 by 2005. But the problem is, with all this happening, there are still major disparities, as you can imagine. Then these were considered by a group of experts in the Institute of Medicine as the 10 biggest public health achievements of the 20th century. Not in any particular order, but it is the first 3 are, I think, in order. Control infectious diseases, particularly the vaccination and immunization program, maternal and infant health, control on neglected tropical diseases, particularly in countries like Sri Lanka, motor vehicle safety, occupational and workplace safety, cancer prevention, recognition of tobacco as a health hazard, safer and healthier foods. This is a group of experts doing that. Maybe you will disagree with, you will agree with some, but I think the first 3 probably we will have to agree. First 3 will probably. Recently, a group of people from the World Bank and WHO sat together and came up with what they thought were they're not moving. This one. It's hung up on me now. Yeah? Got stuck? Anyway, let me stop. It doesn't come in. What I had were the 10 biggest, considered to be the biggest public health achievements of this century. And also, I was going to talk a little, one word about I checked up with the main international agencies in Sri Lanka, WHO, UNICEF, UNFPA, Bank I did not, but all of them, I asked them, what do you consider are the main contributions to the development of health in Sri Lanka? I asked WHO, I have one slide on that, but I'll tell you what they came up with. All of them firstly were very vague, capacity building, voting. I said, no, tell specifically what were the specific things. But basically some of them agreed with, they follow this kind of list. Maternal and child health by all 3. All 3 agencies, UNFPA, UNICEF, and WHO are involved with that, definitely. WHO has made a contribution with regard to response to disasters, the communicable diseases, so mention things which are uniquely, I won't say uniquely, but more akin to WHO's work. The UNICEF stressed the work they do with children in Sri Lanka, and they mentioned a lot of things. So it's mothers, children, communicable diseases, and now, of course, we are entering the phase when non-communicable diseases, including mental health and accidents, will become the priority for most of these agencies to follow. And basically what the agencies have done in Sri Lanka also, it's true in a way, capacity building in terms of training people, both locally and outside, and supporting developmental work, things which the government probably does not have enough funds for. So I can only say that during the last 5-6 decades, great progress was made in raising life expectancy, reducing maternal mortality and other infant and child mortalities through improvements in living conditions, and activities to combat major infectious causes of death. Collectively, interventions such as what I mentioned have contributed to shifts in major causes of death, with chronic non-infectious causes increasingly prevalent and not only in affluent countries, even in low-income, poorer countries. Non-communicable diseases and health conditions are expected to account for an estimated 75% of all deaths worldwide by the year 2030. It's already so here in Sri Lanka. 75% of deaths in Sri Lanka are due to that. And necessarily, this capacity will be tested in the years to come. And I think with whatever maligning that might be extended, directed towards the UN and other bilateral agencies which are in international health, I'm talking only maybe others, I don't know. I think we have to take our hat off once or twice because they try to do a good job. How much they succeed is up to all of us to judge, but they try to do the best they can. Thank you very much, ma'am.